at any time. Since we're all participating today remotely, I'd like to go over a few housekeeping items before we proceed. First, if you're experiencing any connectivity issues, please make sure you or your staff contact our designated technical support so it can be resolved immediately. Members participating remotely must make a reasonable effort to participate on camera, given the need to maintain a quorum. It is committee policy that members will remain muted when not recognized, just like turning your microphone on and off during a hearing in person. This is risky to all members on this committee, and so the background noise does not interfere with another member who is recognized to speak. When you are recognized, you will need to unmute your microphone. And if you wish to be recognized, please raise your hand and communicate through staff that you wish to be recognized and unmute your microphone and ask to be recognized. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteranaffairshearings@mail.house.gov. It will be uploaded to the committee document repository. Please keep in mind that you will need to refresh the repository page as it does not automatically update. Without objection, members will be recognized in order of seniority for questioning witnesses. This makes it easier for me to make sure all members are participating and have the opportunity to be recognized. Does any member have a question about the conduct of this hearing with members participating remotely? Hearing none, I now recognize myself for an opening statement. And before we begin today's hearing, I want to really acknowledge the agony and the pain and the unrest our country is currently experiencing over the wrongful death of George Floyd. And to the family to the Floyd family, I just want to say our hearts ache for you. So good afternoon or good morning, depending on where you are in the country. Thank you all for joining us here today as the country battles COVID-19, a once-in-a-century crisis. An extreme weather event can and most likely will occur before the pandemic is over. With that in mind, we are here today to examine what specific planning, training, and interagency coordination the Department of Veteran Affairs is conducting to ensure an adequately enabled response to a natural disaster during the COVID-19 pandemic. Nearly a year ago, we gathered together in our hearing room when social distancing wasn't necessary to discuss the findings of a VA Inspector General report about VA's emergency cash program. Among other things, the IG found that VA had failed to adequately store supplies, conduct mandatory inspections, and run physical activation drills. That hearing also served as an opportunity to discuss how VA was or was not modifying its emergency response planning to meet the changing nature of disaster as weather events intensify and diseases spread to new regions. It's not lost on any of us the need for a well-coordinated response to a disaster. And so far during the pandemic, VA has done a commendable job navigating new relationships with state governments, tribes, FEMA, and HHS to help address critical public health needs. Yet those partnerships may be tenuous. We've already seen how the pandemic upended medical supply chain reliability around the world, overwhelmed FEMA's existing resources, and stressed states' access to supplies from HHS. The administration's ability to handle both a worldwide public health emergency and seasonal hazards is in question. I ask that you convince us otherwise and provide the committee with the department's plan to duly manage both. I now recognize Ranking Member Dunn for his opening remarks.
Thank you. It's Dunn Moody. Thank you very much, Chairwoman Brown. I appreciate the opportunity to discuss how the Department of Veterans Affairs is preparing for the possibility of responding to yet another disaster while dealing with the COVID-19 disaster. This subcommittee rightly spends the majority of time debating on how to improve the care that VA provides to veterans on every day. And it's always been the VA's primary mission, and will always be the foremost concern of this subcommittee. But the last 3 months have reminded us all of the important role that the VA plays in caring not just for veterans, but for other Americans as well when disaster strikes. The VA's so-called fourth mission is to support the federal government's response to natural disasters and emergencies. Our fourth mission has been tested like never before by the COVID-19 pandemic. Since March, the VA has engaged in its fourth mission assignments in almost every state in the country, as well as the Navajo Nation. Through those assignments, the VAs are providing staffing, supplies, PPE equipment, testing, and other support sorely needed in different communities throughout the country. The VA has been particularly active in state veteran homes and community nursing homes that at-risk veterans and others who we know are especially vulnerable to this virus. In fact, the VA has deployed special nursing home teams trained to clean and sterilize nursing homes and train the staffs at all nursing homes, regardless of whether or not they're formally affiliated with the VA. And I want to commend the hundreds of thousands of VA emergency management personnel, healthcare workers, and other employees for the incredible job that they perform. They've been role models for the country and for healthcare systems. Unfortunately, the work is far from over. Historically, the fourth mission has been used to respond to natural disasters. And as we all know, hurricane season began Monday. My district has seen devastating hurricanes firsthand, and I know just how difficult it can be to prepare for and recover from doing that work while also recovering from a pandemic and attempting a second wave of novel coronavirus challenges. We've never faced this challenge before. And I look forward to learning more today about how the VA will meet that challenge, as I'm confident it, in fact, will meet the challenge. Before I close, I would be remiss in not noting that today's hearing, the subcommittee, is the very first virtual formal hearing that we've had, and I appreciate that Chairwoman Brownlee is coming up with innovative ways for the committee to subcommittee to continue discussing important topics. I do feel that virtual hearings still lack the preparation, transparency, and substance of working together in person. Our work in Congress is no less essential than that of VA employees themselves, but rising to the occasion, finding safe ways to meet and work face to face. As leaders, our job is to lead from the front, not the rear. We can and should be doing this in Washington the way we were elected to do. I'm grateful to all of my colleagues and to our witnesses today for participating in today's virtual hearing. And let me just say how very proud I am of the VA's response to this pandemic. With that, Madam Chair, I yield back.
Well, thank you, Dr. Dunn. And we're also joined today by Chairman Takano. Would you like to make any comments before we begin, Mr. Chairman?
Thank you, Chairwoman Brownlee. I do, and I want to thank you for holding this hearing on this critically important topic. The 2020 Atlantic hurricane season officially began this week, but there have already been 3 named tropical storms. The National Oceanic and Atmospheric Administration is predicting a 60% chance of above normal hurricane activity this year. In addition, the National Interagency Fire Center is predicting, quote, above normal significantly large fire potential, end quote, in the Pacific Northwest, Northern California, and the Southwest this summer due to below normal precipitation. It is therefore important to pause and take stock of VA's preparedness for the unprecedented challenge of responding to natural disasters in the midst of this ongoing pandemic. I was alarmed to read in VA's written testimony that the department is still in the process of drafting its disaster response during a pandemic planning document. Mr. Sitterly, I thank you for being here today. And as you know, hurricane season is already underway. Meteorologists are currently tracking Tropical Storm Cristobal in the Gulf of Mexico that could head to any number of states on the Gulf Coast. Today, I hope we'll learn more about the plan VA is developing, including exactly when it was that VA decided to start putting this plan together. I'm troubled that VA may already be behind. I spoke with Secretary Wilkie yesterday, and he said that VA is, quote, not worried about, end quote, hurricane and disaster season because VA and FEMA are well practiced in dealing with disasters. But I'm concerned that VA may not be taking seriously enough how COVID-19 will affect disaster response. We cannot simply take last year's disaster response plans off the shelf and dust them off. The ongoing pandemic requires a complete reassessment and rethinking of emergency preparedness. It's not enough to have a pandemic plan and a disaster plan. It's clear that we need to have a comprehensive strategy in 2020. COVID-19 makes typical disaster response measures like mass evacuation and sheltering much more complicated. Emergency managers must plan for safely housing people while maintaining safe physical distancing. And rather than moving large populations of people into congregate settings like convention centers and stadiums, as we have done in the past, we need to prepare to move them into hotels and other settings where the risk of spreading COVID-19 can be better managed. Federal, state, and local entities must re-examine seasonal disaster response plans, and we must ensure that healthcare systems have the resources they need, including staff, beds, and personal protective equipment to safely care for evacuees while minimizing the spread of COVID-19. I look forward to hearing more from VA today about the extent to which it has accounted for all of these resources and all these resource needs. We must ensure that VA is prepared for the unimaginably difficult but inevitable challenge of responding to natural disasters and COVID-19 in the coming months. Thank you, Chairwoman Brownlee. I yield back.
Thank you, Chairman Takano. Really appreciate you being with us today. And also we have the full committee's ranking member, Dr. Rowe. Dr. Rowe, would you like to make a few comments before we begin? Not hearing from Dr. Rowe, we will carry on, and I would now like to introduce today's witnesses. We are joined by Mr. Daniel Sitterly, VA's Assistant Secretary for Human Resources and Administration and Operations, Security, and Preparedness, who will speak about VA's ongoing efforts. He's accompanied here today by Ms. Tammy Zarnecki, Deputy Assistant Undersecretary for Health Operations at the Veterans Health Administration, along with Ms. Deborah Kramer, Acting Assistant Undersecretary for Health Support Services at VHA, and Dr. Larry Mull, Executive Director for the Office of Public Health at VHA. Mr. Sitterly, you may now begin, and I recognize you for 5 minutes.
Chairwoman Brownlee, Dr. Dunn, Chairman Dr. Rowe, thank you for joining us as well. Members of the subcommittee, thank you for the opportunity to discuss the Department of Veterans Affairs Preparedness in Disaster and Recovery Readiness. As mentioned, I'm accompanied by Ms. Kramer, Ms. Sarnek, and Dr. Moll today, and we're proud to talk to you about VA's ability to provide world-class healthcare to America's veterans, as well as to the nation, especially during times of crisis like we're experiencing now. As you know, VA has a unique mission in government. We have a unique position in government, and we're present in communities across the 50 states and in the US territories. During COVID-19, VA continued to serve veterans, their families, caregivers, beneficiaries, as well as to fill a critical role in the overall nation's response. To date, VA has provided critical care, medical, surgical, intensive, and long-term to persons not otherwise eligible for VA care in a wide range of communities. VA provided support from New York to California, from long-term care support to training in the proper use of personal protective equipment, laboratory testing, and staffing, VA is providing humanitarian assistance and clinical staff support for the Navajo Nation and the Indian Health Service. And VA continues to reach out to homeless veterans. All told, we have supported 46 FEMA mission assignments, 31 of which are ongoing today. VA has experience dealing with consecutive disasters, such as the California wildfires and Hurricanes Harvey, Irma, and Maria. During those disasters, VA leveraged resources in existing programs such as mobile vet centers, our medical units, emergency nutrition units, and outreach to vulnerable patients and mental health counseling. A natural disaster during a global pandemic will undoubtedly present new challenges and require even more innovative solutions to ensure that the VA mission continues and also serves as the cornerstone to the federal response. Since the VA Emergency Preparedness Act of 2002 became law, we've continued to build our preparedness mission. VA's emergency management and disaster response plans includes one specifically focused on hurricanes during a pandemic. And this year's hurricane season is forecasted, as Chairman Takano already mentioned, to be above average, as indicated by tropical storms Arthur and Bertha, which formed prior to the start of the season. As we sit here today, our VA Integrated Operations Center is preparing facilities from Texas to Florida to deal with Tropical Storm Cristobal. The VA Disaster Response During a Pandemic Plan is published and supports an all hazards response during the COVID-19 pandemic. And it's built around a three-phase operation with objectives and trigger points to inform our decisions. This plan incorporates practices and protocols and procedures developed during the COVID-19 response. And as Eisenhower has often been quoted, plans are worthless, but planning is everything. So this is a living document. It leverages other VA plans and procedures that focuses on three considerations: enterprise notification and asset activation, shelter in place in a COVID-19 environment, and reporting requirements. Most crises, like hurricanes and earthquakes, are short in event duration and long in recovery. The COVID-19 pandemic has been a long duration event, and we have learned many lessons and have adjusted our responses both for a COVID-19 response and for other disasters as well. VA communicates widely and often to both VA patients and staff and provides updated guidance, policy, and frequently asked questions. Enhanced our IT infrastructure, focusing on increasing bandwidth for our employees working remotely, and the continuance and expansion of virtual care through telehealth. This effort enabled VA to continue providing services during the pandemic and has greatly increased readiness and preparedness for the upcoming hurricane season. VA collaborates with FEMA, DoD, HHS, and supports the Federal Coordinating Center and the Federal Medical Stations. We have liaison officers at the FEMA National Response Coordination Center and at each of the 10 FEMA regional centers. We have been seated side by side with our federal partners every day now since February. The embedded VA liaisons will continue to facilitate and coordinate communication between VA, federal, state, local, territorial, and tribal partners to support our ongoing response operations. The bottom line, VA stands ready to execute our noble mission to care for him who shall have borne the battle and for his widow and his orphan in all conditions and through any disasters. Chairwoman Brownlee, we appreciate the subcommittee's continued support. My colleagues and I are prepared to respond to any questions you may have. Thank you.
Thank you, Mr. Sitterly. Appreciate it very much. And I will now recognize myself for 5 minutes of questions. But before I do, as you, Mr. Sitterly, closed with Lincoln's words, to care for him who shall have borne the battle, was, in my opinion, a very poignant statement in 1865 and has been a vivid reminder of the VA's mission for many, many years. But in my opinion, today in the 21st century, it excludes the women veteran who has sacrificed, I believe, equally on the battlefield. And as chair of the Women's Veterans Task Force, we work hard really every single day to ensure equity in the service of our men and women. to the service that our men and women deserve. And we know our women service members are very visible while in the military, but once they leave and become one of our nation's veterans, they become invisible. And that needs to change. And we've been working really, really hard to make that change. And it is just a concern to me that mission statement begins to speak in words, poignant words, but speak of a different time. And today it's a different time when men and women serve. And so I just wanted to make that statement. But I will ask, the first question I'll ask is really to follow up on the chairman's concern and his opening comments, and understanding that the VA is still drafting its disaster response during a pandemic event. So, if you could just share with us why it's still in draft form, and when you think it will be complete and available to medical facilities across the country and certainly to Congress.
That's a great question. Thank you for the question. And I'm happy to tell you that it has been distributed to all of our medical centers across the VA, as well as the FEMA plan, which was completed previous to that. I think one of the exciting opportunities we've had during a crisis, if there is such a thing, is that we've been able to innovate in a lot of different areas across the VA. Secretary Wilkie and our unders and our executive in charge have engaged employees to be able to innovate and understand the risks that they can take in taking care of veterans. Everything from 3D printing to re-engineering through facility tracking systems, how we account for resources, way to comms. So I wouldn't characterize this as a plan which was not started or deliberated. I would characterize this as a plan that has been in work. It will continue to be in work. We will continue planning it. We're working in concert. FEMA also released their plan, as you well know, last week or the week before now, on FEMA's response to natural disaster during COVID-19, and we're happy to work in collaboration with federal partners to ensure the innovation and all of the lessons that we've learned are carried forward into our disaster response as well. Thank you.
Thank you for that. And so can you just tell me when you provided the document to Congress? Because I have not seen it. My staff indicated that they had not seen it either. So was that just recently?
So I don't know of the exact date. I've seen it for a couple of months now in the working pieces of it. We briefed it in our crisis response team. The crisis response team has been stood up at the VA every day now since early March, and our health operations center long before that. So the plan has been briefed to our people. I personally tasked on behalf of Secretary Wilkie last month for our people to take the elements of that plan to ensure that their personal emergency go kits included things related to COVID-19, that we looked at evacuation routes differently, that we looked at our non-congregate locations. And so I'm happy to get you a copy of it as soon as we finish here. But be assured that all of our facilities and our emergency managers have been involved in the planning and the pieces in each as we've gone forward, and they're very familiar with it.
Very good. Well, I appreciate getting a copy. I wish that I had it before the hearing so I could have reviewed it, but that's water over the dam. So, Dr. Stone, I think, I want to commend the VA and how they, have responded to COVID-19. And I think Dr. Stone has been really adamant about VA's humanitarian efforts. And if a community needs VA's help to provide that help, we'll worry about the paperwork later. I commend him in his leadership for that. And I'm just, I guess my question is in terms of moving ahead, not only with COVID-19, but a potential COVID-19 and a natural disaster, would that same kind of direction apply? Mr. Sutterly.
So thank you. Again, I think there have been many lessons learned. If you go into our Health Operations Center today, you could look at the innovation that we're using now to track PPE at the facility level, at the VISN level, across the enterprise, usage, where it is, where it's going. We routinely brief that so that right now, as was mentioned earlier, we're in our preparation for the tropical storm headed up to the coast. So they are marshaling resources to be able to determine where our heavy equipment might need to be moved, where we might need to move perishable gowns, gloves, those sorts of things. So it would be a disaster, no doubt. But I think that the lessons that we've learned and how we our disaster plan asks folks to take into consideration how we do these things in a COVID-19 environment. But our people have been innovative, and we've changed as we've gone. So I think we are headed in the right direction. Thank you.
Thank you, Mr. Sitterly. Appreciate you being here and your team being here. My time is up, and I now recognize Ranking Member Dunn for 5 minutes.
Thank you very much, Chairwoman Brownlee. Let me first make a comment to Dr. Moll. I've been thoroughly impressed by the VA's efforts to support the states during the COVID-19 pandemic, especially nursing homes and other areas of acute need. I commend your success, and I hope to see that momentum continue should the VA be asked to support our communities in the wake of other natural disasters this year, whether they be earthquakes, flooding, disasters, wildfires, or hurricanes. So, Mr. Sidley, does the VA have enough residual capacity to pivot to engage a new disaster on the heels of your massively successful response to the pandemic, but one that also consumed a lot of your resources? Mr. Sidley.
So I will ask Dr. Moll to respond to that if I may. Thank you.
Sure.
Yeah, sure. And thank you for that question.
I'm just looking for your assurance that you guys are ready for another disaster. Because we got one coming.
Since I got booted off WebEx, can I do a mic check? Am I good?
Can't hear you, Dr. Moll.
Come on.
I can hear you just fine.
Really? Okay, I hear Chairwoman Brownlee. I don't hear Dr. Moll. Say something, Dr. Moll.
And Chairwoman, do you?
There you go. You're good.
Voice check. You hear me?
Yeah, we hear you. Speak loudly, please.
Okay, I will apologize. I got booted off WebEx and I had to reboot and everything. Thank you for the question about kind of continuing what I think has been a fairly successful response to COVID and our mission assignments to support the community. I think that, historically we have spent a lot of time, energy planning and working and responding to other natural disasters. And I think that we've learned additional lessons through what's happened with COVID over the last 4 months. And I think that together will help us think about and prepare for resources that we would need to respond to one or the other, or frankly, both at the same time when, for example, our use of PPE may really change following, say, a hurricane.
All right. You think you're ready to pivot to another disaster? That's sort of my question, right?
Yeah, I apologize. I spoke over you. Could you repeat that, sir?
No, I just wanted to hear you say that you think you're ready to pivot to yet another disaster. So it's a military term. You're engaging on one front, you pivot to another front. And your stockpiles of supplies and medications, you feel that those are replenished sufficiently to deal with another front?
Medications wise, to be honest, I would defer to our pharmacy benefits folks. They have looked very closely, for example, the medications for folks on ventilators to determine what's our surge capacity. So I think part of that would be
So,
if
you know,
there
we have limited time on these calls, Dr. Moore. I just, so, and I'm not really thinking about COVID medicines. I'm thinking about now the medications that you have for. So get your pharmacy folks to reach out to my office if you, because I want to know that
Sure.
you're ready for a hurricane or an earthquake, as well as
Yeah.
the COVID. We've spent all this time thinking about COVID, but there are other disasters out there. You've done an outstanding job on the staffing side recently. I'm sure there's some wonderful numbers that you can share with us, given the fact that there's 1 minute left. I think instead I'll ask a question, and I think this is also of you, Dr. Mull. The American Legion stated in its documents they turned in ahead of time, due to COVID-19, VA would not be equipped to handle the influx and injured of another disaster. Do you agree with that assessment?
I don't believe I do. I'd like to talk to the Legion and find out what was behind that statement, but I do think we are prepared.
Please do identify that because that wasn't my impression at all, and I felt like it was a little gratuitous. Let me say in the few seconds remaining to me, I also read all the opening statements, including one from Team Rubicon. I didn't see Mr. Jake Wood from Team Rubicon on the call today, but I know that he interacts with a large number of different agencies, and it would be interesting to have him give his point of view about working with the VA and all the other federal agencies that responded to the pandemic. So if anybody has a contact with Mr. Wood, please ask him to call our offices. I don't have his number. And with that, Madam Chair, I'll yield back.
Thank you, Dr. Dunn. I don't know if the chairman is still with us. I know he had a leadership meeting to get to, and not hearing from him, I will move on to Dr. Rowe. Dr. Rowe, I recognize you for 5 minutes. Okay, Dr. Rowe doesn't seem to be on board. So, Mr. Lamb, you're up.
Can you hear me?
Oh, there you go, Dr. Rowe. Yes, I can hear you now.
Okay, sorry, I'm on the phone part and coming back from my doctor's visit myself. I would like to associate my remarks with what you said. I think we could change, and certainly don't want to change what Abraham Lincoln said, but it's time in the 21st century to change that to those who have borne the battle, which would include all of our veterans, whomever they may be. So I think those comments are very appropriate for today. And secondly, I want to say that I think the VA has done from a disaster preparedness probably over prepared for the COVID, which was good. And I think they've done a very good job. And I hope we're able on the health subcommittee to be able to dig a little deeper about the help that they gave the state nursing homes, the veterans homes, and the expertise that they could for nursing homes in general, because we know if we look at the deaths in this COVID-19, a huge percentage came from nursing homes or long-term care hospitals or long-term care facilities, much out of proportion to the population. So I think we could hold a hearing on that and learn a lot from the VA and what they've done. Also, and I know the chairman did this, and I don't know whether you have or not, Chairwoman Brownlee has, but I visited Puerto Rico and the VA's response down there to the hurricane, two hurricanes almost on top of each other. And I think they did an excellent job, especially with the fourth mission, being able to step out and actually help the community when the community hospital there was overwhelmed. The VA had a very substantial structure, and they took care of kids and the pediatrics and things that they normally would not do. So I think that'd be a great future hearing for the subcommittee and maybe even for the full committee to engage in. Having said that, I think with the hurricane season up on us, I think the secretary yesterday, as the chairman mentioned, we spoke with him, and I don't mean that this is routine, but certainly the VA is very well equipped, I think, and very familiar with a natural disaster, hurricane season or floods and that type thing. I think the COVID threw us the curveball. That one actually did. But when you look at the data, which we get every day, and I thank the VA for that, it tells us where the hotspots are and where they're not. And just an example of where I live here, we have a major VA medical center, and we haven't had a single admission to the hospital for COVID. We're very, very fortunate that we have not. Well prepared, but did not need the resources. So I don't have any real questions at all. I just want to make a statement and appreciate the opportunity to be on. And I'm sorry I'm on by phone, but I appreciate that opportunity, and I yield back.
Thank you, Dr. Rowe. And I too was in Puerto Rico, so I know firsthand what you're speaking about, and concur with you absolutely on the good job that was done there. Mr. Lamb, you're recognized for 5 minutes.
Thank you, Madam Chair. And I'm not sure who is best to respond to the question, but
Mr. Lamb, we can't hear you.
better now?
Yes, much better.
Got to get rid of the headphones. I'm not sure who is best to address this question to, but if somebody could just take it. I know that the VA has done an excellent job in a lot of places helping out state-run veteran homes for seniors. And it looks like even in a few states, you've gone beyond that and helped in civilian-run long-term care and nursing homes that have had these horrible outbreaks. And we have one home in particular in my district that is probably going to be among it's already the deadliest in Pennsylvania, but I think among the national leaders in the number of deaths when all is said and done. And so one of my concerns in the topic of this hearing is that if a large number of VA staff would get kind of diverted or reassigned to dealing with a natural disaster, could that hurt our assistance to the long-term care, both veteran and non-veteran alike? So I was just curious if someone could weigh in on how much time VA staff are spending in these long-term care homes right now, what kind of resources that is taking up, and whether that mission would actually be affected by another natural disaster.
So thank you, Representative. This is Dan Sitterly. I'll start and then turn it over to Ms. Sarnecki. I think she can give you more details, but one of the successes that we've had, thank you to Congress and thank you to the Office of Personnel Management, is our ability to quickly onboard human capital. So within about a 5-week period, we onboarded about 10,000 people. That's unprecedented. And as Dr. Dunn mentioned, our personnel numbers are good. Many of those authorities are temporary, but we brought most of the people on permanently. And so I think we have the human capital, and now we have the systems in our Symphony, in the Health Operations Center, to be able to look at holistically where we have our people, where we have people available to do DEMPs and sort of rotate and to pivot those people to the emergency. So I'll let Ms. Sarnecki add to that if she desires.
Thank you, Mr. Sitterly. And to respond to your question, Representative Lamb, I do believe that we have the resources to support the state veterans homes. I think that one of the challenges has been that VA's community living centers must have a different level of training than some of the community partners and some of our state veterans homes. So we are providing a variety of assistance. Some state veterans homes and some community nursing homes simply need training. Others have needed staffing because a large portion of their staff are out with COVID or a number of their patients are sick. We do have the staffing available to support 2 missions if we need to. Some places we are supporting for 6 to 8 weeks. Some places we're supporting as a strike team for a few days at each nursing home, depending on what the needs are. But yes, I do believe that VA would be able to stretch its resources and support more than 1 mission at a time. And we do appreciate that.
Before I run out of time, the decision to render assistance, whether it's short-term training or a longer-term presence, is that being made at the VISN or at the local level, or are those decisions being made more in national headquarters?
Those decisions are being made by the state veterans homes and the community nursing homes. They're requesting it through their state, and then they're requesting it from us. And that is purely at the local level because they're dedicating those resources.
Okay.
Of
Thank
course,
you very
national-
much for all of you and the work that you're doing on this. I associate myself with those who have talked about the VA's strong response so far. I want to thank you for that, and I hope we can help keep it going. Appreciate it. Madam Chairwoman, I yield back.
Thank you, Mr. Lamb. Is Mr. Barr, calling Mr. Barr for 5 minutes? Not sure if he's joined us yet. I don't see him on the screen, so we'll move to Mr. Levin. Mr. Levin, you're recognized for 5 minutes.
Well, thank you, Chair Brownlee, and thank you to my colleagues on HVAC for this virtual meeting today. I'm very grateful to Chairman Takano and Dr. Rowe for continuing to work in a spirit of bipartisan collaboration through this difficult time. I want to thank our representatives from the VA for helping to serve our veterans, really rising to the occasion. That's particularly true out here in my area in San Diego and Southern California. We're very grateful for all that leadership as our veteran community really is dealing with so many different issues related to this crisis. I had a few questions for you, Mr. Sitterly. In your testimony, you mentioned that VA is drafting a so-called disaster response during a pandemic planning document, and that it is built around a 3-phase operation. Could you speak in more detail about each of these 3 phases?
Yes, thank you, Congressman Levin, for the question. So let me start by saying there's certainly different schools on disaster planning, and some of them are common, some of them are not. But risk assessment, preparing your supplies and equipment and your supply chain, creating emergency management plan, communications, continuity of your mission essential functions, and then testing and training are sort of the common ones across the entire enterprise. And so guidance has guidance in terms of initial response and then recovery. Ours complements that and goes into greater detail. The 3 phases. Phase 1 is the what we're doing right now in the Gulf in preparation for the 3rd tropical storm coming. Post is post-event, where you're in a rapid recovery phase, and then the actual recovery. And so in each of those phases, we have major planning assumptions, assumptions like we'll be operating in a COVID-19 environment, assumptions that we'll be moving people from perhaps long-term care facilities. There's critical considerations that we have, testing where we're bringing people into facilities, feeding facilities, and then we talk about the scope as well as the concept of operations. As you know, the communications piece is a tremendous part of that, as we've been communicating with both our veterans and our employees on COVID-19 and where we are, and we'll continue that should we have a 4th mission request for a hurricane or another disaster response, working with the communities. And I know you only have a little time,
Yep.
but I think it's worth mentioning that the nation's emergency management system works best, I think, and it's most successful when it's locally executed, managed by the states, and then federally supported. And that's sort of our premise going into these. Thank you.
Thank you. And as you noted, VA has increased telehealth utilization in response to the pandemic, which has allowed the department to maintain some continuity of care. As we all know, natural disasters often damage telecommunications infrastructure. How does your disaster planning account for the increasing significance of technology vulnerabilities?
I'll let my VHA counterparts take that one, if I may.
Hi, this is Tammy, and I'll take a piece of it, and then I'll pass it to Dr. Mull. I do believe that we have expanded telehealth where we can provide telehealth from anywhere in the country. And so with the capability that we have, I don't need to be within the disaster zone in order to be providing services. I simply need to make sure that there's cell service or a tower or VSAT. So we have the capability, even with Hurricane Maria, we were able to get telehealth services to the island fairly quickly and provide that level of service. And thanks to our IT partners and the funding that was provided through CARES, we have drastically expanded the capability of telehealth beyond what we anticipated.
Thank you. And if I could just jump in, because I'm running out of time and I wanted to get one last question in. Mr. Sitterly, in late April, the Washington Post reported on PPE shortages at the VA. Dr. Stone told the Post that FEMA directed vendors with equipment on order from VA to instead send it to FEMA to replenish the strategic national stockpile. He said, and I quote, "I had 5 million masks incoming that disappeared." However, FEMA has repeatedly denied diverting PPE orders. Can you clarify what happened?
Ms. Kramer, can you explain that, please?
Yes, certainly, I'd be happy to take that question. FEMA did not take away any material from us. That material had not come inbound to us. It hadn't been identified to us. And so we did not lose anything to FEMA. In fact, FEMA has been a great partner and has supported us a great deal. We are even embedding folks inside of the FEMA task force, specifically in the supply chain task force, to make sure that the linkages are strong. And we are developing relationships with Health and Human Services as the COVID mission switches from FEMA back to HHS. I think the relationship.
I know I'm out of time, but just to clarify, you're saying Dr. Stone got it wrong?
I'm saying that I think it was misunderstood.
Okay, thank you. I'll yield back, Chair. Thank you.
Thank you, Mr. Levin. Mr. Brindisi, recognized for 5 minutes.
Thank you, Chairwoman Brownlee and Ranking Member Dunn, for holding today's hearing. I'm proud that this subcommittee can continue its important work even during the pandemic, and I'm glad that Democrats and Republicans on this committee are committed to working together to provide oversight of the VA and ensure that our veterans receive the benefits that they earned. I wanted to ask a question about PPE supply chain, and this can be for Mr. Sitterly or any of the VA witnesses. But Mr. Sidley, you mentioned in your testimony that the VA is supplying PPE to healthcare facilities and using its existing commercial relationships to ensure the strategic national stockpile is ready for disaster responses, including future pandemics. Can you tell us more about how the VA is evaluating its PPE reserves? How are you working to restock? And then I have some other follow-up questions.
Ms. Kramer, you want to respond, please?
Certainly, Mr. Sidley, thank you. Yes, we are partnering with other government departments, DoD, Health and Human Services, FDA, in addition to working with industry so we can optimize our readiness and offset any potential problems. There's not a lot of resiliency available in the supply chain today. And so we've got to build that resiliency into the supply chain by working with our partners, but also by taking on some work of our own. And among that is we're increasing the amount of material all of our VA medical centers hold. We want to establish regional readiness centers, not depots, and hold material there that will give us, combined with the hospital's 4 to 6 months of material, that'll give us a little bit of resilience until the supply chain has a chance to catch up with the need. We also want to do vendor management of VA-owned material, 3D printing and agile manufacturing, and of course, participation in FDA's Life Extension Program. We think all of those will give us, along with working with our partners, the ability to build the resilience in that is lacking under the current PPE route.
Thank you. If America is hit with a second wave, chances are that other parts of the world will face that at the same time, once again setting off a worldwide race for PPE and other medical items. What is the VA doing to prepare for a situation like that?
Well, that is one of the big reasons we want to establish those regional readiness centers. The idea here is that we would actually bring material into hold, either physically in those, or as I said, with something like vendor managed inventory, and build up stockage levels that would allow us to have what we need on hand. The other thing that we have is, being the largest integrated healthcare system in the country, we have the ability to shift assets from a point where need is low to a point where need is high. So going back to what Dr. Rowe said, where he thought the hospital in his area had probably over-prepared, his hospital in his area was a part of VHA's enterprise solution. And so it's important that they have as much material as somebody else, so that if we need to shift those assets to a point of need, we can do that very, very quickly.
It's important for America's manufacturing base to be ready when disaster strikes. Does the VA give any preferential treatment to American manufacturers of PPE when negotiating contracts?
We try to do that. That's the first choice, is to do the Buy American. But unfortunately, as you know, most PPE is made overseas. That is one of the challenges. We are trying to reach overseas to bring material back here to the United States. We need more domestic-based manufacturing
Okay,
because that's the national solution to the PPE shortage that all of us are facing.
okay. And then just one quick final question. What sort of lessons has VHA learned? This can be for anybody. VHA learned from the past 3 months that will help you be better prepared for a second wave.
Thank you. I'll take a stab at that first. I think be prepared early and to respond early, to get our people together, to communicate early, to get message to the field early, and then the central command and control so that we can feed the various, especially in the pandemic. It went differently across America. So to be able to command and control our resources, to move our DEMPS program, I think is the biggest lesson learned. And then I would be and thank this Congress for your Family First Act and also the CARES Act. We would not have been nearly as successful without getting those through. And so the human capital part of me says I hope that we can continue this conversation and make some of those authorities so that we can respond a little bit quicker. Thank you.
Absolutely. Well, thank you. I'll yield back my time. Thank you, Chairwoman Brownlee.
Thank you, Mr. Brindisi, and I now call on Mr. Rose. Recognize Mr. Rose for 5 minutes. Mr. Rose? Mr. Rose is not here. Mr. Cisneros, are you on board here? I recognize you for 5 minutes.
I'm here.
Very
So,
good.
can you hear me?
I can.
All right. Thank you, Madam Chairwoman. I appreciate all our guests being here today. One of the things I want to bring up, Mr. Sitterly, we know in earlier testimony there was, that one of they went through the supplies at the different emergency centers there, and some of them, the supplies that were outdated, they had medications that were outdated. What has the VA done since then in these past few months to try and rework those to make sure that supplies that have been located in those facilities have been updated, that medication's been updated?
Tell you that the command and control, once again, the command and control was essential to knowing where our supplies were, knowing where incoming been ordered, and knowing the usage rates and knowing where they're going. And so our Healthcare Operations Center has that information available 24 hours a day, 7 days a week to be able to swing what we have to locations that may be utilizing more than others. I'll let my VHA team members give some more details if they choose.
Anyone?
Hi, this is Tammy. I think you're referring to probably the report that we had on the emergency caches that the OIG had done. We have made drastic improvements. Dr. Mo is leading that team, and I'll let him speak to the changes that we've made. But you will not find that our caches have any outdated supplies or medications, and all the inspections were done as they were to be done in 2019.
Yeah, and this is Larry, reiterate that we addressed all 7 recommendations from the IG and reworked everything from our training to our policies to our inventory management to our inspection process and so forth to make sure that our caches were ready in the event they were needed.
Great. Also, Mr. Sitterly, I have concerns that the VA has been utilized hydroxychloroquine as a treatment for COVID-19, a treatment that remains an unproven treatment for the virus. And I know the VA has made a large purchase of that medication earlier in the year. How is the VA ensuring that they are effectively utilizing appropriate resources to stock up crucial supplies missing if we're going and spending resources on an unproven treatment?
again, I'll turn it over to my health administration experts to respond to that.
Yeah, Mr. Cisneros, this is Larry. The original purchase that was done was actually done in part to make sure that the veterans who truly needed that for an indication where you would use hydroxychloroquine would have that medication. So that was part of why that purchase was what it was. So just to clear that. What we've seen is our providers across the country have been who have been treating COVID patients and COVID veterans have been to try and provide them with the best care they can. There have not been many options for treatment. They've used the information they have to try and provide some sort of therapy. Hydroxychloroquine was one that was tried in the system. When you look at the numbers now, there's very little of it being used outside of a clinical trial.
Okay. The last question I have as we wrap it up here is, Paralyzed Veterans of America and testimony that they've given earlier in the year said that it's unclear if VHA has tested the department's ability to simultaneously handle 2 or more disasters. Do you agree with that statement? Do you believe that the VA would be able to handle multiple disasters going on?
Thank you, Congressman Cisneros. I think the VA is well suited to be able to handle multiple disasters. We have learned so much from this COVID-19 pandemic that we could apply in other areas. We have done multiple casualty disasters before, and I think we're well suited to be able to do that now. Thank you.
Okay. And so I will ask this as I wrap up, but have we ever tested that? The ability to do more than multiple disasters, or is there ever a plan to test that if we can handle more?
So thank you for the question. So we have multiple ways in which we train and we test and we sort of stress our systems. So we've stressed our systems during this. We've done tabletops, but the real stressor is the actual disasters themselves. So while we're doing COVID-19, we're also tracking 31 locations where we have protests going on. We've evacuated locations. We're watching those. We're watching the hurricane as it comes in. We have done wildfires at the same time that we did hurricanes. So certainly at some point, if the system enough with real world situations, it'll break. But I am confident our plan 0320 that we have call for testing of our facilities and testing on recurring basis, both in-person evacuations, in-person movement of people, in testing equipment. So I think that we have tested it, but the real test, and we've done it in real disasters, but the real test will be the magnitude of the emergency and the disaster. Thank you.
All right. Well, thank you for your responses, and I yield back.
Thank you, Mr. Cisneros. I see that Chairman Takano is back with us. Mr. Chairman, would you like to be recognized for some questions?
I would, if you please.
Please proceed.
Thank you. Mr. Sitterly, I mentioned in my opening statement the challenge of mass evacuations during a pandemic. I want to know how VA plans to coordinate and safely evacuate veterans from their homes, VA facilities, state veterans homes, or community nursing homes. It seems particularly important that VA's plans address the movement of these vulnerable patients during a pandemic environment, within pandemic environment.
Yeah, that is a great question, Mr. Chairman. Thank you for that. As I mentioned, I think as you come out of the room for a moment, our most success will be when we're able to work with the local communities, with the state community, to provide what we have. So we will be sitting side by side with the disaster recovery response officials, coordinating movement of vehicles, coordinating movement of food equipment, and those sorts of things. Our role, obviously, will be to ensure the safety of the people from a COVID-19, from the medical perspective, to make sure that we're overseeing the movement of inpatients and those sorts of things. That's exactly what our operational guidance plan asks all of our facilities to consider ahead of time now before it happens, is what are those new evacuation routes? What are those facilities in your community that are most vulnerable? We talked about long care facilities. We know that they are most vulnerable. We still have some mission assignments in place in some of our long-term state veterans homes across. And so we will wrap those lessons learned as to how socially distance and move those people. It will be a challenge for sure, but we will be partnered with our federal, state, local agencies in doing that as well.
Well, thank you. During hurricanes, such as in 2017, VA sheltered veterans employees in own facilities. Will sheltering in VA facilities be allowed during the 2020 hurricane season? And if not, how will VA assist with non-congregate shelter?
So I think, as you well know, Mr. Chairman, our facilities is a handmade wooden shoe in terms of their footprint, their capabilities, their facilities. We have over 8,000 facilities across the VA. Some of them are together, some of them are not. Certainly in our plan that we've leadership at the local facility level to do, it has a serious consideration for sheltering in place. Where we need to do that, we will certainly do that, where we have the capability to do that. Additionally, our ability to look at where we have our temper tents, our ability now through this entire COVID-19 pandemic to work with the Department of Defense. We've moved equipment on military air. We've moved equipment on commercial air. We have used the extent of all of the resources. And I'm confident, I have been part of the crisis response team every single day for a couple of months now, 3 months. I'm confident that the relationships that we have built with the emergency coordinators at the federal level and our other agencies will serve us well in a response to a disaster. Thank you, Mr.
In Puerto Rico, many Title V employees sheltered at the VA while the storm was happening, and we're serving veterans, but they weren't paid. Do we need to take a second look at this policy and make sure that Title V employees get paid during these sorts of disasters? When they shelter actually at VA facilities away from their families?
Yes, sir. And I think you probably comment in my sincere gratitude to this Congress for ensuring that Families First Act and the CARES Act covered so many things that we had anticipated, but we couldn't cover. And so from an authorization perspective with personnel, from Title 38 versus Title 5, pay, benefits, aggregate pay, shelter in place, per diem, those sorts of things, we absolutely will come to you with the lessons learned that we've learned from this pandemic and see how we can apply those to future disasters, either permanently or temporarily, as we work our way through the response of this. So thank you.
Thank you. One more question in. To what extent does VA have contracts in place for veterans to move into hotels and other non-congregate settings should they need to evacuate during a disaster? Please provide specific examples, locations, and the scope of these contracts.
So we have several contracts. They're very much different across the facilities, as you might imagine. I'll ask Ms. Sarnecki if she can respond a little bit more in detail on the specific ones. But I will tell you that we found acquisition and contract one of the critical nodes of dealing with the pandemic, and we've worked through a lot of those to put expediting of contracts. And maybe Ms. Kramer can respond, but let me turn it to my colleagues.
I've already gone over time. We can get that. If you can get that information to us, I certainly would appreciate it. And I want to know to what extent such contracts are already being used as part of the ongoing pandemic. I'll take that. I'll take that at the staff level, but I don't want to take up any more time. Thank you.
Thank you, Mr. Chairman.
Thank you.
Thank you, Mr. Chairman. And now recognize Mr. Sablon for 5 minutes.
Yeah, thank you, Madam Chair, for holding this hearing. I have a question to probably Mr. Shirley or Dr. Moore. The Northern Marianas is, again, the only place in the country without a CBOC or a vet center. what exactly have you done to prepare the Northern Marianas for the upcoming typhoon seasons? Probably because of um, the rising temperature of the ocean, we have been hit with particularly strong typhoons, and the past 3 years consequent, one after another. The, the typhoon we had a little over in 2019, the end of 2019 was two typhoons actually in less than 2 months. But the second one, Super Typhoon U2, is the second largest storm recorded in U.S. history since 1935. So what exactly are you doing to prepare the Northern Marianas for in case there's another typhoon this year? It usually starts in September.
Thank you, Representative. Certainly, our territories give us more logistical challenges, but the successes of the pandemic in providing healthcare to our veterans has been our ability to do telehealth and to ensure that we stay connected to our veterans. I'll ask Ms. Sarnecki if she wants to respond specifically to that, but that has been one of the many lessons learned in taking care of our veterans.
Hi, yes, thank you, Representative. We did in the past provide telehealth services to the Marianas post typhoon, and we would do that again. We can provide staffing and assistance on the island once everything clears, but we have to be able to get there first. Our staff that we do have on the island are able to and are trained to provide the support needed to provide telehealth when possible. And unfortunately, there are some logistical challenges, but they generally partner with Hawaii and are able to get service.
Right. So let me ask you, Mr. Janeski, because you're responding. What kind of staffing did you send to the Marianas for Typhoon Mangkhut, for Typhoon U2, or even Typhoon Sodular?
I don't know if I would have to look back to see if we actually sent the staffing or if we just provided the telehealth.
Because I don't recall that being Marianas type. And when you say the territories, you're assuming that territories include the Marianas. We don't have any CBOC here. We have the admin staff that I'm not gonna but Preparedness is not as far as I know and fortunate. We're all one athlete for the territories and on you don't have access on. So you can practice to me with months to be doing for Mariana.
Absolutely.
Thank you.
We will go back and make sure that we emergency management in North America into consideration. Thank you.
And you with it so I could get it. Thank you.
Thank you, Mr. Hassan. We really appreciate being here in the early hours of your time zone. So
I just want to see you.
well, it's good to see you, I have to say. So thanks. And just want to mention that Mr. Rose, that we're bar that join us. I don't. So if you have a question, minutes, I would. Dr.
Conference called 3 months to leave, but I want to thank and I want to thank all of us for time and effort and commend this crisis the one and for the next crisis. Good work. Thank
Now, thank you, Dr. Dunn. I appreciate your presence as well. And before one was, I also went the chairman both went to Puerto Rico. One of the things I heard folks in Puerto Rico is that elderly and disabled veterans who were living without electricity and they much impact had electricity with refrigeration, bed lifts, or battery powered wheelchairs. This was a real issue that just came up and over and over again. And in our investigation, we were told that the VA only issued generators veterans who are on ventilators. So, Mr. Secretary, has that changed at all, or has the VA considered, generators to our vulnerable veterans in areas that are frequently affected by climate change issues?
I was not here during that. Lessons learned. We do have lessons learned. Let me ask my colleagues if they have specific.
Hi, this is Amy. I don't have a good.
Chairwoman Brownlee, let me take that back for the record and get back to the changes as a result of learn from the disaster.
Okay, very good. Because, for hurricanes, loss of electricity is like you can't have a hurricane without losing electricity. And so it's like the electric their ability medication. I would very much. So, we will close. Thank all the members for participating, and certainly thank the witness for being here today. And I want to. I think it's really been proven that you're a national leader in this COVID-19 landscape in terms of response, and so really appreciate leadership. I think and hearing the response today, one of the concerns that I'm thinking about as I hear learn or COVID-19 as it relates to the possibility of a disaster occurring during COVID. I think we need the lessons learned from COVID, lessons learned naturally may floods, hurricanes, because the same I think the patient from COVID-19 is there are challenge if this situation COVID with an we're going to be something the VA has faced before, and God, we're the ability and our staff exactly how they is be able to serve event or multiple pandemic and so really to us as you're continuing to modify a plan disaster in the COVID landscape, and we'll look for just for and for being members. Day marks this is